Thank you to the chairperson of the committee for hearing my testimony this afternoon. So my name is Dr. Angela Slitt. I'm a professor in the College of Pharmacy at the University of Rhode Island, as well as an NIH-funded investigator on a joint URI-Harvard Superfund Center that is out of the University of Rhode Island. It's a $9 million NIH-funded grant to study the health effects of PFAS. So I will speak to you a little bit about some of the human health effects. So it's known that some PFAS, ones that have been banned already, such as PFAS and PFOA, have been shown in humans to be linked to disease like cardiovascular disease. So for example, increasing cholesterol levels, preeclampsia, thyroid disease, some types of cancer, as well as low birth weight. And this doesn't also speak to the numerous adverse health effects that we see in rodents. Now, as a college, being in a college of pharmacy, I think a lot about PFAS like drugs. And what I can tell you in my expertise and as a toxicologist by training, so had I gone onto the pharma industry, I would have done toxicity studies on rodents to enable drugs getting kind of like going on to get used. This is a class of chemical that is very concerning because of the fact that it crosses the placenta. It gets to the fetus. It really is very effective in getting into breast milk. And they have very long half-lives. So coming back to one of your questions was, what can we do? Well, one of the things that we know is that when PFAS and PFOA were withdrawn from the market, that was one of the largest drivers for lowering the levels of PFAS in the American population. So it's not to say that you can't do things, but we know when we withdraw those chemicals from the market, it affects everyone. And coming back to filters, you can put filters on water, certain types of activated filters, but what I would say to you is, do those who are socioeconomically challenged go out and buy water filters? You know, is this a situation where we might be able to remove the longer chains, maybe not the shorter chain PFAS, and we can do that, but maybe not everyone. So coming back to the notion of drugs, when we take drugs, we take them voluntarily, and we often take drugs that our bodies can break down. These have half-lives of anywhere from 4 to 8 years. And some of the replacements that are still on the market have a half-life of 8 years. When we go and we collaborate with our Harvard colleagues and they look at the livers from whales, or our URI colleague and they look at livers from birds, we just don't see PFAS and PFOA. We see many other PFAS. There are over 3,000 on the commercial market, and it is too challenging to regulate and understand them one by one. So that's kind of where we're at. And I can tell you that if these were drugs for pregnant women and children, we'd have a very, very hard time advocating for their safety because of the long half-life and the numerous types of biological pathways within the body that they modulate. So I think I'll stop there. If anyone has any questions about human health effects, I'd be happy to answer them.